Yeah, patient centricity, that's a big topic indeed. Yeah, because most projects start as a business in any case, right? So everybody has to focus on the revenue at some point, right? And with that, unfortunately, many people focus on serving who will pay, right? And who will pay is often a provider, a sponsor of medical research, or payer, something, rarely the patient, right? So there's a lot of focus on the institutions, on the companies, on that side, and not that much on the patients, right? So the patient is usually a second thought, unfortunately. And for some, it's a thin layer of varnish, which is very unfortunate, right? So yeah, that's a real big challenge because there's a conflict of interest somehow between the revenue side and who we serving, right? In the medical sector or health sector, it's a bit unusual because there's this triangle, right, between the patient, who is paying, and who is providing the service, right? And so it's very hard to focus on the patients. At Adam 7, we try to really focus on the patient by first building health record for the patients and then use it for something else after. So that's one of the approaches that we try to have. That's a good question and tough to answer too, right? Contributing to research per se is interesting for some patients, but not all of them, right? For seriously sick patients, those wanting to contribute to finding a treatment for themselves, for the close ones, that there's a very strong motivation there, right? For others, there's a motivation to contribute to the common good, which is good, but it's not a very strong focus, right? The majority of patients have more important things to do than contributing to research, right? And focusing on managing their health issues is very important for them, whether they are significant or less serious, I would say, or less serious disease, right? So they need to focus on themselves before focusing on research and helping others. It's only human, it's natural, right? So to get more patients contribute to research, we need to do more, right? We really need to offer them very interesting tools for them. Sometimes financial contributions are needed, right? Let's face it. But very useful tools can also be a good solution. For example, a personal health record or some tool to help them manage their health information or insights. But it has to be really focused on the patients and not as a second thought, as I was saying earlier, right? Uh, and then if we provide a very useful tool to the patients, the rest, so the part that is about research and collecting of data with the consent of patient must be very easy to do, right? The patients should be, it should be a no-brainer for the patients, right? And I know by experience that a small difference in an application that is just slightly better, but much easier to use will make a huge difference, right? The patients will keep using it. Otherwise, they won't because it's just a bit too difficult. And if it took you as a company 3 years to build, well, it's pretty unfortunate, right? If they don't use it. So building tools very useful for the patient is one, and second, it must be very well designed and very easy to use so that the part that is contributing to research is very easy for the patients. They don't have much to do.